Hello, I'm Dr. Obey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have another great show for you. And I'm so happy that the physician who's here tonight has been able to come back and do this particular topic. I will tell you what the topic is. It's going to be arthritis. And boy, oh boy, oh boy, I know arthritis. Believe me, the knees start creaking. Oh, we're all going to talk about that because we're going to cover it extensively for you tonight. Before we do that, I want to go into the topic of sharing and caring. And remember those med moments. It's so important that you listen to your body. When your body's telling you need to go to see your physician, take heed. Check it out now. You want to check it out while something can be done or while it's mild and just a little medication may be able to take care of it. But if you wait, it's like that car commercial. Either you're going to see me now or see me later. But you should always check it out. Check it out first. All right? That's good. That's good. Let's talk, guys. There's something that I'd like to talk about today, and it's called your daily meal and your plan. And let's understand our food groups and exactly what they mean for us as far as health and as far as a healthy meal and what a healthy meal and portions are consist of. Listen, it all comes down to choices and portions. If you're trying to lose weight or if you're trying to gain weight, it all depends on the type of foods that you choose and the portions of that food that you take. All right? So if you take too much food in, more food or more calories than your body can burn, then guess what? You're going to gain weight. So if you're taking less and you're very active and you're burning more calories, then you're going to lose a little weight. So get that to get that understanding is very important. Well, food groups. Let's talk about grains. Grains, as far as a daily serving, it should be 6 or 8 servings of grains per day. And grains are like whole wheat bread, rolls, bagels. That's what we're talking about. Vegetables, like leafy green vegetables, collard greens, peas, things like that. It should be 4 to 5 servings per day. As our fruits, like apples and bananas and grapes, you should have 4 to 5 servings a day of that as well. Dairy, like milk or cheese, these should be 2 or 3 servings a day. Lean meats like poultry and fish, 6 ounces or less per day. Alrighty? As far as your nuts are concerned, we're talking about 1/3 cup is a serving. You should have 4 to 5 times a week. Now this is a week, 4 to 5 servings a week. Alrighty? And fats and oils, we're talking about 1 teaspoon, that would be a serving. It would be 2 or 3 per day. And sweets, well, we're talking sweets, you know what sweets are, candy bars and stuff like that. What they recommend actually is 5 or less per week. Alrighty. So this is a healthy daily plan as far as keeping your weight under control and seeing if we can, stay that optimal weight for your height, because that is the way that we have a chance to maintain good health. All right. Let's talk about our topic today. It's arthritis. Very important topic. So many of us have arthritis out there. And if you're old, guess what? The likelihood is you will know Arthur. There's just no way around it. The older we get, we wear out our joints and arthritis sets in. So let's learn a little bit more about it. And today I have the perfect person to talk about it. Her name is Dr. Wen Xiong, and she's a rheumatologist. And Dr. Xiong is coming back to visit us on our show. Dr. Xiong, welcome to our show.
I'm very happy to be here.
Oh, well, so happy. You're happy. I'm happy that you could return, as you could take time out of your busy schedule, because I know everybody's schedule is so busy these days to come and talk about arthritis for us. So let's get started. Dr. Xiong, what is arthritis?
Arthritis is actually the form of the condition. It's not a really single disease because there's so many types of arthritis. It just means there's some problem with the joint.
Okay.
So the joint is there. It's an area of the body where two different bones connect. So, and the joints can move their body parts connected by all these bones, so it can function to move all these joints, so they can be more flexible and move into all this activity. You can walk and to move and lifting, so all these things. That's what a joint is.
Okay.
So when there are problems with the joint, that's arthritis.
Okay, so that's a understanding that as I get older, things may happen to that joint. So now I can bend it like this, but you know what I mean?
Right.
30 years from now, I may be only been like that because it's kind of worn out. It's stiff now. And that's what we're talking about.
Yes.
All righty. Now, tell me about the different types of arthritis. What are the types of arthritis, and how common is each type?
So there are actually over 100 types of different arthritis.
Woof.
Yes, so it was surprising it is. So the most common the type of arthritis in adults is actually called osteoarthritis, which is a degenerative of the type of arthritis when the cartilage wears out. That's what they're talking about. Most people are talking about arthritis when we get in stiff and pain. That's mostly referred to osteoarthritis.
Now, osteoarthritis, is that with the big joints, like the knees? If my knees start hurting as I get older and stuff, that's where osteoarthritis sets in?
Right. So most common joints affected by osteoarthritis are the knees, hips, and also the hands. Actually, mostly the thumbs, and sometimes the wrists and the shoulders, but most commonly on knees.
Okay.
Right.
All right. Other types of arthritis?
So other type of arthritis, like a rheumatoid arthritis, and that's one we call it one of the autoimmune disease effect causing a chronic inflammation of the joints. Okay. This is a total different arthritis. When the autoimmune disease, what it is our own immune system actually causing any problem, mistakenly attacking their own tissues.
So it's actually the body attacking itself.
Right.
And it's attacking itself at the joints. And that's what automatic immune type thing system comes into play.
Right.
All righty.
So what happened is our immune system is supposed to protect ourselves to fighting all the infections.
Right.
But those immune cells or antibodies, when they start getting overactive, then attack their joints and then cause a lot of swollen inflammation. That's what is rheumatoid arthritis occurs.
Okay, so the knees, or whatever joint it is, it actually swells up and it gets big. Does it get hot and red as well?
Yes, so from time to time when it flares, and then the rheumatoid arthritis, when the patient has flares of rheumatoid arthritis, they get a lot of swollen stiffness in the joints, especially in the fingers, like a wrist and the fingers, and also the ankles. And then so they have a lot of stiffening in the morning. So the stiffening in the morning can last for hours.
Right.
So that's what one of the very typical feature of the rheumatoid arthritis.
Okay.
And then it's get swollen too. And then if it is not treated, over years, those joints can get damaged so quickly and then causing deformity. So it's a very severe type.
Okay, we're going to get in a little more detail later. What's the another one? What's the other one? Gout.
Gout. Yeah,
That's
right.
Tell me about gout.
Gout is most common arthritis in men, affecting men. So, and also is most severe, and when the gout happens, the symptoms is so severe is most men would refer to is the worst pain they ever experienced in their whole life. So the gout is one type of what happens is the uric acid is a chemical when body breaks down the purines. The purines comes from the human cells and also coming from the certain food. When the uric acid level in the blood is elevated, and the bodies cannot get rid of the uric acid adequately, quick enough, and then they sit into the joints and produce some like a needle, like the crystals, and then cause a lot of severe, sudden onset of the joint pain. Usually for men is like the big toes. So that's the way the gout is.
Alrighty. Describe how a joint is put together for me. I know it's the bones are there and they say it's a joint, but how does it all come together?
So, for example, for the knee joint, that's a very typical joint. So the knee there's bone there. On top of the bone, we call it cartilage, which is a cushioning surface on the end of the bones. And then around the cartilage connect two different bones that we call the synovial membranes, which is that's where the fluid, we have all the lubricant fluid and nutrition to actually nutrition to this joint to become very, so the joint can function like very smoothly move around. So that's what how the structure of the joint is.
Okay, so you have bone and bone.
Right.
Then you have a cartilage layer.
Right.
All right. Then you have the synovial membrane.
Right.
And the synovial membrane is where like the blood vessels and all the nutrients come through.
So actually, in the synovial membrane, there's no blood vessels.
Oh, there's no blood.
Right.
All right.
So there is
I was making it up.
Right. So
No,
the nutrients and the other nutrients just actually sits into the synovial fluid in there.
Oh.
So the reason there is no blood vessel, that's why a lot of time when the joints has a condition there, it doesn't spread to other part of the body sometimes because it's only stay in there. So that's why sometimes we use some certain treatment only going to the joints because it doesn't go to the, if you take medication by mouth, it may not affect the joint because there's not much blood vessels. There's no blood vessels. So that's why you can see sometimes we do the treatment, we actually directly go into the joint.
So you may actually put a needle right into the joint for the treatment as opposed to giving them a pill that would try, whatever medication, it would go around the body in the blood vessels.
Right.
Now you just put it right into the joint because the joint doesn't have many blood vessels.
That's correct.
All right.
That's right.
Excellent. Excellent.
And also the orthopedic doctor will do some surgeries to change the whole set because there's when it damaged, then nothing really can really fix it because there's no nutrition, there's no blood vessel there, so there's just totally damaged. So that's why we have to change the whole thing if it's severe damaged. So.
Okay. So as you wear your joint, as you use the joint over years and years and years, that synovial membrane and that cartilage wears down.
Yes, mostly for the osteoarthritis. That's what we refer to cartilage wears down.
Okay.
From year to year, from the trauma or pressure or aging, and then so that cartilage wears down, become thinner and thinner. So then the bone rubbers against bones. That's when the crack is coming from.
You hear
it when it cracks because the bone was actually kind of rubbers against the bone, always a little drier because the synovial fluid where the synovial membrane and in case, which is there's not much fluid in there. That's what become drier. That's where all the noise is coming from when you move it around.
What about, and I always think about this, what about people that have had prior injuries, like football players, like the kids who are playing football and stuff? Are they more prone to have a problem with arthritis as they get older?
Yes, that actually, even though there's no evidence showing absolute evidence for, but there's definitely can show when the people a lot of prior injury, when they injure their ligaments, when they injure their the cap we call the ligament or muscles, they lose the support for the joint. Then they do tends to get more osteoarthritis.
Okay.
Right. So that happen.
So let's just go with, and we're just going to hit the topics. We're going to go back at rheumatoid arthritis just for a minute. Now, you said that, and I want to get a plain understanding of this. This is like the system in the body that usually protects us. The autoimmune or the immune system actually attacks the joint. Do we know why this happens?
We actually don't know why it happened, but we know certain genes, certain genetic effect. Also, if you have family history, if you have family who has rheumatoid arthritis, you may carry the genes. With in combination with environmental triggers like smoking and or other trigger. In fact, sometimes even the infections actually can both of the trigger the genes to be changing their immune cells and the reaction to the immune cells.
Right.
So then the immune cells become a little bit overactive and start to produce some antibody. When they produce antibody, they actually recognize those what some of the cells as a foreign body start to produce inflammation, try to damage or try to cause inflammation in that fluid and then cause a lot of swelling.
Right.
So and also they can not just only affect the joint, they also actually sometimes can go to affect the other system, other organs like our kidneys, lungs, or eyes. So that's why
arthritis can affect those as well. Rheumatoid arthritis.
Mostly in rheumatoid arthritis, right?
Okay.
So that's why rheumatoid arthritis is also form of, we call it systemic disease because it affects the inside of all the bodies, including those lungs and kidneys and eyes.
So the antibodies actually can affect the kidneys. It can affect. I know it can affect the lung with scarring and rheumatoid nodules in the lung. It can affect the eyes. You said, boy, oh boy, something else. What about as far as rheumatoid arthritis? Is it more common in men or women for that particular one as well?
It's more common in women.
Oh, in
Yes,
the females.
right, in females, right. And usually a factor from aging group from 20 to 40 or 50 years old women.
Oh, so it's a younger group
A younger
that
group.
usually gets the rheumatoid arthritis.
Yes.
What about children? Can children get this?
And children can get there. Also, we call it, we call it juvenile idiopathic osteoarthritis, idiopathic juvenile arthritis. So it's actually similar to rheumatoid arthritis as adult. So they have a different type of, yes. Children can get also the rheumatoid arthritis, but they call it juvenile.
Okay, all righty, excellent, excellent. Now, as far as treatments for this, I would figure that things like physical therapy and things like that would be important as far as rheumatoid arthritis.
Yes, it's very important. So not only the physical therapy, and in terms of rheumatoid arthritis, also more important also is we call it disease-modified medication.
Okay.
So what it is the medication actually can alter this inflammation in the body to slow down the progression of the disease. But what that means is actually slow down the damage of the joint, so they can actually preserve, actually to save the joint, save the cartilage. So in the long term, it actually can save the joint from the permanent deformity.
Okay.
So that is why the disease-modified medication for this condition is very important.
So you're talking about inflammation, you're actually talking about swelling.
Yes.
So these
Yes.
medications, what they do is they actually go after areas that are swollen
Yes.
and decrease the swelling. So over time, we're preserving the joint,
Right.
and the joint isn't continually being hurt.
Yes. So
Okay, all righty. I want to step back. Let's hit the osteoarthritis just for a second, because I want to cover all aspects of arthritis. And let's do the osteoarthritis now. Tell me more about this particular arthritis.
So osteoarthritis, because it's like I said before, so because it's affected their cartilage, so it's when they have if they have a previous injury, if they have overweight, if you put excessive weight to the bone, to the cartilage, and also if there's besides their put in a little injury, so they also can cause the cartilage to become wears out, and then they start having those stiffness and the pain and the swelling. So and people have difficulty to walk, to stand up, to actually after sitting for a long time, or they climb the stairs. So that's what the osteoarthritis.
Well, I often see older patients coming into my office, and they're with a cane. And especially when they try to get up out of a chair, I mean, you can see their knees is it's just really painful. That's what we're talking about with osteoarthritis. I really want to see if we can put a face to this and let them know exactly what's occurring to them.
Right. So after usually when a patient always complaining when they're sitting for a long time, when they get up, they're very difficult to get up because the bone was actually very close to the bone. There's no cartilage left. They actually produce the vacuum effect. So because of the vacuum effect, they actually, when they close together, when they try to stand up, there's a vacuum to holding those bones together. Then it hurts the most because that's where extreme pressure to actually putting on that bones that's causing a lot of pain. So that's why a lot of people said they get a lot of pain when they try to get up from the sitting.
Okay.
So that's the very common symptoms they have it. Also, other symptoms is like they cannot going upstairs or going downstairs because they're putting the pressure to one leg when they go up and downstairs.
Oh, all right. So
right.
if you're a heavy person,
Right.
and you're bearing a lot of weight on your bones. If you're trying to go upstairs, then you're right. If you step on that one particular leg,
Right.
you're putting all your
the-
weight on that knee.
in one leg, right? So that's why you sustain more weight on this particular bone. Then the cartilage said, I can't hold on this weight. That's why the problem's coming. So that's why there's no problem for them to go into this activity.
Now, is this the type of arthritis that you would consider sending them to an orthopedist for knee transplant? Not a transplant, but a knee artificial knee?
So it depends on severity. So the osteoarthritis is mild, moderate, and severe. So usually there is also the different types of treatment. So if it's mild, then we give the patient going to the physical therapy, and then the exercise, if we lose weight, and also take some pain medication. If they can maintain their function, if they can walk, if they can maintain a function level, they can walk and take care of themselves, most people, they may not need to do the surgery.
Right.
But if all these people who have severe type of osteoarthritis, when their cartilage completely damaged, there's no cartilage left, the bone is completely against the bone. Right. So, and then when they have a pain all the time, they cannot walk, and then those the patients you need to change the knee code. That's what we said for the orthopedic doctor to change the knee.
To put a new knee in.
Right, to put a new knee, to brand new knee, because there's also some type of a complication after surgery. That's why we try to let the patient knows what the expectation is. But if they are totally destroyed, then they should go to the orthopedic doctor to get it.
Now I know that not to cut you off, but I know that sometimes I see patients with their knees all swollen and everything like that. Right. A lot of times there's fluid in there. How do we deal with that fluid in the knee?
So if anytime you see a lot of swelling, a lot of fluid in there, we need to take it. We need to remove it, the fluid, because the fluid inside of the knee, they put extra pressure to the capsule, which is a surrounding membrane, surrounding structure around the knee. When they put extra pressure in it, they cause much more pain. So any fluid, if it's excess fluid in the knee, we need to take it out. We need to remove the fluid. We aspirate the fluid out. So that's going to give a lot of relief after that.
Okay.
So, right.
All right. So the patient actually feels a lot better once they get that.
Once they get to remove the fluid, they feel a lot better after that.
It's no fun having a needle in your knee. I understand that. But if I feel better afterwards, I guess I'll have to close my eyes and let you do it.
Right. So a lot of time we put a numb medication to numb it, so you don't feel
so you don't feel it as much.
You don't feel it much. So it's not as scary as it thinks, right?
All righty. Let me advance here, because I want to talk about gout.
Right.
All righty. Tell me about this. You say this is the most common arthritis?
Yes, it's the most common arthritis in men.
In men?
Right.
Oh, now I understand.
A woman has more common in osteoarthritis, rheumatoid arthritis more common because genetic reason, because other reasons. So for men, usually after a certain age, and then it was most adult men can be affected for the gout. Is very commonly because for some reason men has less less enzyme to get rid of the uric acid from their kidney.
No.
So, and also the diet and the preparation is also the men. Maybe sometimes there's the different preference for the diet. That's why for some reason the man has much more common has this gout. So,
all right.
But then when the gout happens, most men will suffer a lot because they would remember for the rest of their life, because that's the most severe pain they can ever suffer from this gout. Right?
Some of my patients are saying that when their gout flares up, if the sheet blows by their skin, it hurts. It hurts.
That's true. That's true. That's how much it is. Even the wind blows through their skin, they hurts. So that's how severe it's, how painful it is from the gout. Yes.
Let me ask a question. Do we know why it favors the big toe?
That's a good question.
Yeah, it's always like somebody said, "Oh, my big toe." The first thing I think of is gout.
Actually, I don't know. But I know what for fact is. For men, it's over 70 to 80% of men when they have a gout is going to be at the big toe.
Interesting.
But for women, it's less common. Probably up to 50%. For 50% chance they could have a big toe, but it also more often to happen to the knees and hands and fingers. So in women, but for men it's more typically in the big toe. So that's why a lot of people said, if I don't have if my big toe is not affected, if it affected other joint is not gout, which is not true.
Okay.
Because women can be affected by gout within other joints, in the hands, in the wrist, elbows, and knees, ankles.
Okay.
So right. So that's the difference between men and women when they have the gout. So.
Okay. Gout, you can get gouty nodules too, right?
Yes.
Like, why do you get those big nodules on you when you have severe gout? What's happening there?
So all the nodules is actually the crystals, and
the crystals.
Yeah, the crystals.
Yeah, that uric acid that you were talking about.
Deposited by uric acid, right? So when the uric acid elevated all the time, chronically elevated all the time in the blood, meaning that uric acid stay sitting in the blood so for too long, they will sit somewhere. So they sit. That's where the nodules coming from. That's where the uric acid crystals sitting in the elbows, and then nerve, some of the hands, fingers, and also the knees, and also the other area, and even the ears.
Ears too?
Yes, ear
Oh,
too.
goodness.
Right, we call it tophi, which is the little nodules. That's what we name for tophi, which is uric acid crystals.
Do you ever have to take these nodules off? Is it ever that bad?
Actually, yes. So for people who has a chronic gout, which is we call it tophi, or nodules become very big, it's cosmetically not pleasant.
Right.
So a lot of people we can actually remove it by surgery, right? Remove by surgery. Yes.
Okay.
We do
And
that
sometimes with gout, do you actually get distortion of your fingers and stuff like that with the gout?
Yes, when the gout is very severe, chronically affected, they have a gout attack almost every week or every month, and then those uric acid constantly high, then they can produce and they can give a lot of nodules in there.
Okay.
Very chronic, a lot of nodules in the hands, right?
Okay.
Big nodules, right?
Let's cover treatment of gout. We're running out of time just a little bit, but we want to cover treatment of gout, gouty arthritis. Tell me a little bit about the treatment. How do we?
So because it's the extreme inflammation, so we use anti-inflammatory medication.
So
medication
decrease the swelling,
yes.
Anti-swelling medications
Right.
we're talking
so
about.
the important part for the gout treatment is you have to use as early as possible and use the adequate dose. So if people delay the treatment, the gout can actually prolong for like 2 or 3 weeks. If you treat the gout in the first 6 hours, you can stop the gout right there. So that's most important. When you had a gout attack, go see your doctor, go to the ER. If you get a treatment within 6 hours of the onset, you can stop this gout right away. So that's what we tell our patient. You take medication within 6 hours of onset, don't delay it. If you delay it, the gout can actually last longer.
Interesting.
So, and besides that, the second part is we have to tell patient the diet. So the gout is definitely purely diet related, because some certain food like seafood, shelled seafood, red meat has a lot of purines. That's when the body when they try to break down, it's going to become a lot of uric acid.
All right.
So that's a lot of things
We're going to have to call it right there,
Right,
Dr.
no
Xiong.
problem.
Thank you very much for coming in. We've
so
run out
happy
of
to be here.
time. I
That's
trust we had more. All righty. So in closing, remember, sharing and caring. All right, guys, think about each other out there, talk about your medical moments, and go see your doctor, okay? Never institute any change in your medical care until you visit your physician. All righty. And I trust each and every one of you continued good health. Listen, also, look at us on obeyyourdoctor.com. Come, check out the TV show. Have a lot of topics out there. You just may need to look at one, and it may help you with your medical care, okay? This is A Moment in Medicine, and until next time, I want to say peace to you all. So